to help them deal with problems and make important decisions regarding the nutritional conditions of their child who are less than 5 years old. So again, I would like to emphasize refer to counseling as a professional guidance counselor or an individual which utilizing psychological methods. Okay, so let me emphasize also the two key concepts when we deal in the management of SAM. So for the past 2 days you have seen or you have learned the important role of mothers, okay, mothers or caregivers in the recognition, monitoring, and treatment of a child with SAM. The worker should be well equipped also in counseling to ensure that the messages are delivered across and the procedures are properly done. Because if not, this will greatly impact the holistic management of a child with SAM. So for the first concept, first there's a role of the mother here in the management, in the holistic management of a child with SAM. We have some evidences. There are lots of evidences already. But let me just give you one article. So this is an article, a research study by Nikki Blackwell, which was done in 2015 in Nigeria, where they have included they had enrolled 103 children ages from 6 months to 5 years. No? So what they did here is that they compared the capability of mothers to measure or to do the procedure MUAC measurement. Okay, so they compared this to those who have trainings in IMAM or in acute malnutrition SAM. So these are the community health workers in that area. And surprisingly, there are so mothers, despite the brief training, they can perform the MUAC just like the well-trained community health workers and have a high sensitivity and specificity to detect SAM. So the significance of this study now is that mothers really can be a focal point of screening strategies and be included in malnutrition treatment programs. Okay, so with that introduction, let's go to session one. We have to learn about the stages of behavior change. So when we talk about behavior change, in the context of SAM management, this pertains to how a mother, a parent, or a caregiver go through the different stages before a change in behavior can occur. So for a health worker to see positive results, it is very important to understand the concept of behavior change. So the objective here is to describe and distinguish the stages of behavior change the mother and the caregiver is in regarding the care of their child with severe malnutrition. So here are the stages. First, we have the unaware. So these are the group of parents or caregivers who've never heard about SAM or never about the behavior or doesn't know anything about its benefits. So they are really fully unaware. Now next is the thinking about it. These are a group of parents or people who has heard about that behavior but is not doing anything about it, even though they sense that I think my child has it but have the disease or some, they're just thinking about it. They just heard about it from someone else. The next stage is the trying, is trying the behavior. So meaning you've heard about it, now he is trying to do or to make some action of what he have learned from someone else. And the fourth is maintaining the behavior. This is continuing to do the behavior. He have learned about it, he have tried it, and now he's trying to go and have follow-up visits because he wants to maintain and have tried, and it seems that there's a positive impact to the child. Now he's maintaining it. No? But more importantly, we also have the fifth stage. Okay, It is advocacy. So advocacy is the fifth stage in which the counselee or the parent or the client does not only continue to practice the behavior, but also encourages and influences others to do the same. So this is the group of people who have tested the behavior and now they're sharing, they're trying to influence others to do the same. So very important that the knowledge of these stages, no, where counseling clients is in, is vital in order to apply the appropriate approach in counseling. So this is a very important slide. Okay, so let's do some exercises. First situation, we have here a girl. Anna is the mother of Annie, who was identified to have SAM
Alis na ako eh.
in a routine community visit by the health worker. So with this, the mother, what is the stage where the mother is here? Most likely unaware, because this is just a routine community visit. They went there and these community health workers tried to do screening and they saw Anna, or they have seen this child to be a patient, a SAM patient, and the mother is unaware. So what will be the approach of that community health worker or the doctor or the nurse who will be visiting this patient? Of course, there will be much of more explaining to do, no? Because they don't know about SAM. So you have to explain what is SAM to Anna and also explain the benefits of identifying SAM. Why? Bakit kailangan niyang malaman na ang SAM, na may SAM ang anak niya? Kasi kagaya, because of the, if you want to review or you have to review the previous lectures before, SAM, nakakamatay po to, di ba? So, very important din na you have to emphasize, explain to the mom what is SAM and why she needs to know that her child is a SAM patient and we need to have intervention. Next situation is Juana. Juana is the mother of Juanito, no? Just identified to have SAM and is now being told that she has to bring her son to the outpatient therapeutic care. She is aware of SAM from talking to her neighbor, Anna, whose child Annie was identified the week before. So, eto, the mother here, Juana, is already thinking about it. Why? Thinking about it because she already have the idea about Sam. She learned it from the mother of Annie. Now, since her child was identified to have Sam, who is a Sam also patient, now she's thinking about it. Okay, no action was taken back. Okay, so what will be our approach? Of course, you have to encourage Juana to go to the OTC. You already know that Juana already have some idea about SAM, no? However, for her to learn more, you have to encourage her to go to the OTC so that she will learn more about the case of her son and also to learn about SAM, about the management of SAM. Okay. Also, it is your duty to identify also the reasons if this mom will be hesitant to go to the OTC. And probably you will discuss this. Most likely you will discuss this to her. Okay? So the third situation is Teresa, the mother of Teresita, a child identified to have SAM and brought to the OTC for the first time and is being counseled to come for succeeding visits. So again, the behavior change here is trying it. She already, Teresa, who is the mother, who has already tried to go to the OTC, no, and have her child checked by the doctor or the health worker, and then counseling have already started. So what you will do now is, as the health worker, you encourage Teresa to continue the visits to the OTC until her child becomes well. You have to praise her for her persistence and effort to bring her child to the OTC. And of course, the effort of continuing what is being advised to her. Now, this is also an opportunity for you to identify and solve any problems that might prevent her from continuing bringing Teresita to OTC. No? Okay, here is another situation where Lisa is the mother of Lizzie, who was identified to have SAM and brought to the OTC, but has to be brought to ITC after 2 weeks because she was not responding adequately. Okay, so what is the behavior change for the mother is in? Maintaining it. Why? Because she's been 2 weeks therapy already. She's been going into the OTC every now and then as scheduled. She's been very compliant, no? And she's maintaining. However, she has to be referred to the ITC because there are no response or probably a slow response because every time we usually have a target here, and if we don't get that goal, we have to refer them definitely to the ITC. So what will be your approach? Of course, even though that's the situation, still you have to praise Lisa for continuing to care for Lizzie. No? You have to explain to her why there is a need to carry on the management further. Identify and solve any problems that might prevent her from continuing care. So the usual thing here is, for example, she's been in the RUSF, RUTF, she's been given in the OTC. However, probably nagkaroon siya ng diarrhea, no? Those are some comorbidities that could exaggerate the condition. That's why you have to explain to her the importance of referring this patient to the ITC. So with that, you have seen the importance of knowing the stages of behavior change. And this will direct you on how, or guide you on how to approach in counseling. Now let's go to session 2, which is one of the most important aspect of this module also. Counseling skills. So in this session, you will be able to describe the different skills, no, necessary for counseling to be successful. Okay. So sometimes this is parang ginagawa na natin actually. These are very basic already, especially if we are health workers. These are all must-have skills, no? Again, just to emphasize that counseling is just part of communication skills, which should be well developed among health workers. Anyone tasked to do counseling to a mother, a caregiver, parent, or even the other family members in the community should be competent in the skill of counseling. Okay, so let's go to the first, skills for establishing rapport. Establishing rapport is a crucial step in every healthcare worker and patient encounters. No, actually not only patient, parents encounters in the counseling process. So rapport establishes trust between you and the mother or the caregiver. And more often, first impressions last. That's the reason why we need to give our shot during the first visit and maintain it during succeeding visits. No? So no matter how dreadful, how gloomy the day, while you are doing your visits, no? Try to put a smile in that face, on that face. Be friendly and be respectful, no? Because by doing this, it will trigger more positivity in your first encounter as well as in your succeeding encounters. So again, speak in a gentle voice. Sabi nila, kung hindi ka gentle voice dati, medyo try to practice speaking in a gentle voice. No? Talk to the mother and caregiver and the whole family if necessary. And explain the reason for talking to her. Do not forget to introduce yourself. No? You have to tell her why you are doing a home visit. So, another is the skill for asking and listening. So, open-ended questions rather than closed-ended questions are preferred because, let's say, what are the words for open-ended questions or statements? So, why, how, What? Please describe. Can you explain further? So it is a means for you as the interviewer to explore more of her thoughts and the feelings of the counselee, okay, or the parent. And with that, you will be able to extract what are really the issues or the concerns with regards to the health of the child, or within you will also gain or get some information about the family dynamics. So show that you are listening. When you approach the counselor or the parent, you should show that you are listening. Again, body language matters. Sometimes body language speaks louder than the verbal or the words that come from our mouth. We should not be so authoritarian looking, no? Yung iba kasi nai-intimidate sila pag nakakitang nakaputi yung pumupunta sa houses nila o kahit man lang sa clinic, di po ba? Kung nakikita na naka-white, parang ay siya yung doktor, parang ganito. Kaya sometimes if you are going to talk to them, it should be eye level lang, no? Kasi some people would tend to misinterpret na kung nakatayo ka, parang wow, authority to, parang ganun. Kaya sometimes they do not disclose. Eye contact matters. Reflection. So when you reflect, meaning try to try to listen carefully, and then later on try to tell again the story that she has expressed to you or she has given to you, the information, and probably let's say if you need to clarify something, you clarify to her, no? And then later on, she will reflect back, ano na nga ba yung mga nangyari? So again, with that, mas magiging makwento siya, mas marami kang information that you will be able to get, no? Aside from that, reflect feelings. You have to empathize, no? Pag medyo sad siya, parang naiiyak na siya, sometimes you have to say, yes, I understand you. Alam ko po yung pinagdadaanan nyo. Even sometimes, sa katotohanan, hindi mo alam yung pinagdadaanan niya, no? But actually, that's one part where you can really establish rapport to your patient. And again, do not use judgmental words because there are really many parents who are very sensitive, no? So sometimes we have to be careful of the words that we are going to use when we are conversing with them. So here are just images. We'll just describe, no? So you will see here, body language pa lang. Actually, you can also see here some distractions. Ano yung mga distractions dito? The health worker standing, and the papers, the folders are all in front of her. No, that's a distraction. So if you are going to note or encode something from the information that you're getting from your client, better you have to put it down on the table, sit down, eye level, and talk. Lang parang kayo lang nag-uusap lang ng maayos, no? And you have to be attentive to what the mother is going to tell you. Number 2 here, you can see here, there's a child. If there is a other family member in that area where you are interviewing, probably pwede nyo pong pakiusapan na kunin muna nila yung bata. Because majority of cases, if the child tends to be irritable, mawawala yung trend ng thought kasi ng mom. That's the reason why mas maganda po na focus lang siya with the interview so that you will also engage other members of the family to help. No? So here again, should be comfortable, face to face, but look at this image. No? You cannot even identify which one is the patient here or which one is the mother. Or actually, this is an adolescent teen mom. Okay, so they are checking on the plot. No? They're plotting how is the progress of the child. No? So again, mas maganda pong face to face kasi it's uncomfortable. Okay, next, here again, we have distractions here again. Diba? Face-to-face dapat. There's a child there, and we have all the data sheets. Ideally, in an ideal setup, dapat po wala po yun. It's just like talking normally, no? Without any distractions dapat. Okay? So these are just simple images. These are actual images during training. So next is skills for giving relevant information. So again, here, you don't give everything in one sitting because sometimes if they are overloaded with information, wala po siyang maalala ni isa sa sasabihin ninyo po. So actually, it's very important to see, prioritize what you are going to tell to this patient. No? So again, you have also to consider or accept or acknowledge what the parent or the mother thinks or feels. Hindi mo siya pwedeng i-force na ganito ang gawin mo, ganito ang gawin mo. Do not command. Instead, just make suggestions. No? So how, for example, I have difficulty because my husband is working, the grandparents or my mother is also working, my father is in the field, I'm alone in the house, I'm taking care of this undernourished or some patient, and I cannot even do the house chores. Ang dami na niyang sinabi, no? However, you as the counselee should be attentive, should listen carefully, and later on, once na-express na po niya lahat, yung mga sasabihin niya, mga concerns niya, later on, you can give some inputs or suggestion one by one dun sa kanya mga binigay na mga problema niya, concerns. Kasi sometimes, if you want to give solutions to everything, mas lalong walang mangyayari, no? Walang matatapos. So, make it simple as possible. Give information in short sentences and use simple language. If you are very good in the local dialect, so be it. Example, I came because I need to follow up kung kumusta na yung anemia. Anemic kasi yung anak mo, no? Ano na nga ba yung anemic? So if you know the dialect, sabihin mo, na po siya nga minji, dara na, iso nga kailangan tayo nga, ikati vitamins. No? And eventually, pag nag-sink in yan, na-process na yan, everything, saka mo na i-discuss kung ano yung vitamin na bakit mo bibigyan ng iron supplement or folic supplement, kung ano man yung vitamin na yan. Make it simple. No? Hayaan mo rin siya, allow the parent to ask questions. Okay? So skills for checking understanding, this is very important. No? You have to check the understanding using open-ended questions. No? Sometimes you let the parent or the family members repeat what needs to be done in her own words. No? This will give you feedback that they truly understood what you have discussed to them. No? Kung medyo mahirap nila express, again, you have to be patient. You may also repeat the advice in a different way. O kaya, mas nag-grasp nila na magbigay ka ng example, no? Based on your experience as a community health worker or a doctor or a nurse. So very important yon. And then eventually, pag meron ng understanding, common understanding of what she will do and how she will do the procedure, praise her na okay, ang ganda, nagkaintindihan na tayo and pa-follow up ko na lang kung kumusta ang pagbibigay mo ng RUTF sa anak mo. So mga ganon, you have to praise every now and then. So this one, the skills for helping mother formulate solutions to the problem. Actually, this is the heart of counseling. Why? Because this probably is the most important process in the counseling process, because this is encouraging the family to express what they plan to do about the behavior or the issue on their child that you have talked about. No? So encourage them to tell you if they have other concerns and problems, no? Which especially when it's related to the management of the SAM patient or the child in their home. No? So very important po itong aspect na to. If ever they have expressed everything, you have to engage other family members, the grandpa, the grandma, ni ate, si kuya. No? It's a family. You have to learn the family dynamics. If you see that the members are very engaging, then include them in the planning process on how to solve the problem of the child in that home. So, another aspect is breaking the news. Actually, this is one of the a difficult part, no, in counseling. Sometimes it's really necessary to relay the bad news. na hindi nag-e-epekto po yung 2 weeks na nagbibigay tayo, kaya kailangan po niya ma-refer sa ITC. Or, mas mahirap ito if there's death, no? Actually, breaking the bad news effectively, take note of it, effectively is important because it shapes the entire management of experience for the child and their family from that point onwards. Kasi how you give the news will affect their acceptance with what you will be advising them eventually. No? Kung pangit yung dating, namatay naman yan, wala naman palang pag-asa, kahit bigyan mo yan ng mga ganyang sinasabi nilang mga RUTF o yung mga ikonsulta mo siya sa ITF, wala din, namatay din naman. Di ba? May mga ganun po eh. Kaya we should have a very good skill on breaking the bad news. So there are two. We have the nonverbal communication, the verbal communication, and the mixed type. So pwede mo siyang pag-mixin. So again, nonverbal, be kind and gentle. No? Allow the mother to react in her own way. If the mother is sitting down there crying, sit down with her. If you have, of course, you have to give time. For example, sa mga doctors natin, nasa ER yan, busy yan, no? Make sure that you have someone else too. Like for example, the nurse or the social worker beside you. Para in case after the explaining, after pacifying, or after giving every support that you can give to this patient, to this parent who lost their child, no? You can also go back to your usual work, pero dapat nandun yung support team ng hospital nyo or yung ER, no? The social worker, the nurse, or sino man po ang nandoon. Also, touch her appropriately. Pwede mong itap naman siya. Kasi meron naman mga touchy sa atin. Di ba? Gusto nating itap. Okay, naiintindihan. I'm very sorry what happened. You can just call. You can just ask me if you have some questions. Mga ganun, no? You can tap. Okay? Pero please, do not leave the mother alone. No? Okay. For the verbal skills, use simple non-technical terms. No? Your child died of hypovolemic shock. Pwede na mo ng i-local dialect yan. Mami, namatay po kasi ang ating anak dahil po sa labis na pagdurugo. Gusto niyo po ba? No? Kung gusto pa niya ng explanation, I will give you time. Ganun po. No? You have to explain. Ang hirap po talaga, lalo na kung nagmamadali ka or toxic na toxic yung ER, you cannot just do yung ganun. Parang kung minsan nakakalimutan po natin, especially doctors and nurses, namatay po siya sa hypoglycemia, hypovolemic shock, and everything, mga gano'n, no? Or heart failure, ano daw, gaganon yung parent, lalo na death yan, no? So you give her time to ask questions. Speak softly, and ito pa po, very common po ito sa atin, dito sa Ilocos, dito sa Cordillera, we have to respect her cultural beliefs and customs, no? Kasi kung minsan, meron tayong mga processes in the hospitals, no, that we strictly follow. Pero dagito'y gusto na nilang ilabas yung parent, yung patient, I should say, because of some cultural beliefs, no? So, we have to respect them. Ask if there is anyone near the hospital who can be with her, and of course, we have to express our regret. So, I think this is my last slide, but this is a very important tool for counselors or health workers just like us and doctors, no? The blueprint for change. So actually this blueprint or this tool is a guide for health workers or counselors, no? So that we can plan, no, on how we could help our clients, especially these parents who have these problems with regards to how they can manage the many factors that affect their family in caring for a child with SAM. So stage 1, just an overall, just a summary for stage 1. This is the current scenario. Ito yung nangyayari ngayon. So you have to let the client or the mother tell the story about how she is now that she know that she has a SAM child, no? Meron tayong malnourished child. And hayaan mong ikwento niya lahat kung ano yung mga pangyayari din sa bahay, yung family dynamics niya. Wala po kasi kami pong trabaho, ma'am. Tapos hindi po ako nakapag-aral. 18 lang po ako. Dalawa na po yung anak namin. Gusto ko po sana kasing mag-aral pero ganito po kasi ang sitwasyon namin ngayon. So that's the stage 1. So you have to have a listening ear during this time sa stage 1, no? And then you identify sa lahat ng sinabi niya, what are the gaps? And determine now the issues that you should address. But in determining the issues, you should prioritize, no? Now let's go to stage 2. This is the time when the parent or the mother will express ano kayang thinking niya kung ganito yung sitwasyon. Ganito po kasi ma'am yung ideal na gusto ko sana sa mga anak ko, na napapakain ko po sila ng masustansya, may trabaho po kaming mag-asawa, makakapag-aral po ako, yung mga ganon na ano niya, na mga thoughts niya. So you have to facilitate that, no? Yun yung gusto niyang maging scenario. However, after identifying possibilities, kaya ito, so yun na, you have to employ the, are we all familiar with the SMART? Yung specific, measurable ba, attainable or achievable ba, no? Realistic ba yung mga parang iniisip natin, no? And time bound, kailan niya kaya pwedeng gawin yon? So, in the third stage, dito sa action strategies, dito niyo na po pag sama-samahin lahat ng mga nakuha nyo sa stage 1, stage 2, so you can already help this parent, this family as a whole, on how to address all the problems pertaining to, yun nga, ang naging consequence niya is, ito nga, meron ng bata na malnourished and how they will give solution to this problem. So, that is the action leading to desired outcome, sabi nga niya dito. So, this is a very important tool that I would like you to adopt probably when you are doing your counseling. And again, take note, please, hindi po itong blueprint na to, hindi po siya change in one day. It can be as long as 5 years, no? So kung you are a very committed health worker na binabalik-balikan mo itong mga pamilya na to, na may SAM patients, nako, ang ganda po, no? You can see the change eventually. So as a parting words, okay, so counseling in the context of SAM may be very challenging for most of us, no? But a health worker, well-equipped with the knowledge and basic skills we have discussed, we have learned in this webinar, coupled with diligence and commitment, surely you will make a big difference in the lives of the children and their families we serve. Thank you so much.